Hello everyone, welcome back to my YouTube channel. Today we'll be talking about medical tests that every woman should be doing at every decade of their life in order to make sure that your health is top notch. And what are those doctors that you need to visit so that you will be able to do this test accordingly at every decade of your life? I mean, starting from 20 years old and above, 20s, 30s, 40s and above. Now let's get to this subject so I can unravel everything I know about this subject. So starting from 20-year-old, there is need for you to start doing your blood pressure test. Blood pressure test is used to determine if your blood pressure is high or not. Okay, for someone whose blood pressure is high, you should start from 140 to over 90. That is calculating the systolic and the diastolic level. Okay, then we also have the second one is the fasting blood sugar. Fasting blood sugar is used to determine if your blood sugar, the sugar level is high in your blood or not. For me, I just got mine done last week, about a week ago. I can't remember exactly the date, but I just got it done not quite long. My blood pressure test and my fasting blood sugar, and it turned out to be normal, and it's something good. So it's something that as from 20 years old you start doing this test regularly, at least every year, once a year. That one you don't need a special doctor for it. It's just any normal doctor in the hospital can do it for you. You don't need a special doctor for this. Okay, so then the third one is the cholesterol test. Okay, cholesterol level test is used to determine the risk of coronary heart diseases. Okay, so this should be done at least every 4 to 6 years. As a 20-year-old and above person, every woman can do this starting from 20 years old. Then the third one is the pelvic exams, which can be done by an obstetrician or a gynecologist. That's basically the same thing. So like I said in my previous videos, there's need for every woman to start visiting the gynecologist at least every once a year. This is because usually women have diseases that are peculiar to them. Okay, so such disease, there's need for you to examine your pelvic, to do your pelvic exam at least once a year. A gynecologist is a person, a man or woman, who is in charge of or who specializes in treating women's diseases. So that will help him or her to determine if there's any problem in your pelvic or not. The fifth one, also done by a gynecologist, is the pap smear. The pap smear is a test to determine if someone is at the risk of getting diseases such as the cervical cancer. Okay, so there is need for a woman starting from 20-year-old or even lower to go get this test done. And for women under 26 years old, there's also a need for, I mentioned this in my previous videos, I remember. There's also a need, if you are below 26 years old, you need to get a HPV injection. Okay, a HPV injection to prevent cervical cancer. Okay, and there's also need for you to go to the doctor and get a pap smear. There's a special doctor for that, which is the obstetrician or a gynecologist. Okay, getting this test will help to determine if you're at risk of getting a cervical cancer or not. And if it's not, you can do this every 2 years, starting from 2 years, 20 years and above. Okay, so the sixth one is the STD screenings. There's also need for you as a woman to get STD screenings done every year, or at least every 2 years. The next one will be the dental exam every 6 months or at least 1 year. There's need for you to examine and clean every 6 months, and that's it for a 20-year-old. Now we move over to the 30-year-old and the 40-year-old. So for women in their 30s, it's also important that you keep up with those tests that you have been doing in your 20s, such as the cholesterol test, pap smear test, high BP test, and the rest of it that we mentioned for your 20s. Do not stop them just because you are now 30. Okay, so it's also important that you get your pap smear test every 3 years. Maybe not every 2 years like you're doing in your 20s, but now every 3 years. Another one is the thyroid stimulating hormone test. The thyroid stimulating hormone test is done in order to find out if your thyroid gland, which is producing the hormone, is working properly the way it should be working. The way it should be working. Now, this test can tell you if your thyroid stimulator is overactive, which is hyperthyroidism, or underactive, which is hypothyroidism. The test can dictate if there is a thyroid disorder before you get any symptoms, because if left untreated, a thyroid disorder can cause health problems. So the next thing that you want to do in your 30s is, if you're not yet married and still having kids, it's important that you meet your gynecologist once in a while to discuss your conception. Okay, if you are willing to conceive, okay, later in life, what are your options if you are not able to conceive when you get married or when you are ready to start conceiving? It's also very, very important. The next thing is your vaccinations. There are some vaccinations that you need to take, such as the pertussis, whooping cough, diphtheria, and tetanus injections or vaccinations. It's also important that you get them every 10 years. Okay, even when you are already past 30 to 40, 50 years, you need to get them every decade. All right. Now let's go over to 40 years and above. Okay, what are those tests that you need to perform, or what are those doctors that you need to see in your 40 years and above? For 40 years, keep up with those tests in your 20s and in your 30s. Then there's also the mammogram test. The mammogram test to determine size of breast cancer in women. You can as well have the mouth cancer screening. These two tests are very important the moment you get to 40 years old and above. Okay, and start taking them. Your doctor will refer you to a good radiologist who is going to do that examination for you. Also, you need to discuss with your primary care doctor about bone loss. At 40 years, women might start losing their bone. So it's important that you find out from your doctor, primary care doctor, discuss it with him so that you guard against this situation. Let's talk about 50 years and above. What about 50 years and above? Continue with those tests that you can start from your 20 and above. Signs of menopause might have started setting in or not. So you need to talk to your obstetrician to find out what you are going to expect and how to, manage the situation about menopause. It's very, very important. During menopause, it might be painful. Okay, so you need to start talking to your doctor as soon as possible concerning menopause. While discussing your menopausal symptoms with your obstetrician, it's also important that you discuss the pros and cons of hormone replacement therapy so that you find out if you should do it or not. Okay. Also, you need to get the other one that you need to get is the bone density test. Your obstetrician might as well refer you to a technician, a radiologic technician, who is going to conduct a bone density test. Okay. Then it will be read by a radiologist. These tests are very, very important. Another test that you might want to conduct is the colonoscopy test done by a gastroenterologist. This is to be able to find out your rectal screening to find out if it's working properly or not. So the next one is osteoporosis. You need to discuss with your doctor if you're at risk of osteoporosis. Get the test done for bone loss so that you find out in time if there's a problem with your bone, and then you start managing them in time. Hoping you liked the video that I just did or you just watched. Please, if you do, don't forget to ask any question you have or any comments down below in the comment section. And then please do well to subscribe if this is your first time and you enjoyed this video. Don't forget to like and share to your friends. Thank you. Till next time. Bye.